Good morning. I'm Dr. Strauss, the medical director at the clinic. Nowadays, with so many young people who have joined our team, I guess I'm getting to be known as the old guy at the clinic, which I don't particularly like, but it's also an honor and a blessing to have been able to serve this community for so long. This year, the clinic launched the Keeping the Promise, Building Hope campaign, which is for a new building for the Clinic for Special Children that we hope will carry the mission long into the future for generations of families to come. I've been asked by a lot of people what this new building means and why do we need one? We have such a nice building here in Strasbourg. So let me take you back in time this morning. My first visit to the clinic was in 1993. That was the day that I met Holmes and Caroline Morton for the first time. And I was inspired, deeply inspired by their dream, by their mission, which at that time had really just gotten started. Let me give you a glimpse of what was happening at the clinic at that time. By the end of the year 1990, about 33 years ago, the road to the Clinic for Special Children was still made of dirt and gravel. There was one doctor who took care of just fewer than 100 patients. And he focused on about 10 genetic disorders, most of which were found within Lancaster County. The lab at that time at the clinic was open 24 hours a day, but offered two tests: amino acid analysis and organic acid analysis. The CSC at that time employed 4 people and had a budget of about $170,000 a year. I think it's fair to say the Mortons at that time, for all of their vision, could never have seen this, what we have today. So what is it now, 33 years later? Now the CSC has a budget of about $5 million a year and employs 32 people full-time to care for 1,500 people with special medical needs, children and adults. The lab offers literally hundreds of advanced genetic tests, and many of these tests are the most advanced tests available anywhere in the world. And the lab continues to innovate and create new testing opportunities every year. Patients now come to the Clinic for Special Children from 44 states and 17 countries to receive special care. While the number of staff and patients and disorders has grown, we're now treating more than 400 genetic conditions there. The services have also grown. So what kinds of services can you get at the clinic today that you couldn't get in 1990? You can get state-of-the-art genetic testing. Parents, young couples, can get carrier testing for future children. There's genetic counseling services. There's subspecialty services for orthopedics, cardiology. There's vision testing, hearing testing. There's a dedicated home-based palliative care service for babies with lethal genetic disorders to protect them from going to the hospital. There are regular outreach clinics. And then there's educational opportunities for families, for the community, for young professionals, and for the families, especially, that want to understand how to best care for their children. There's also a research program that is just at the forefront of one of the biggest revolutions in medicine that might allow us to actually find effective treatments for many of the disorders that have caused so much suffering in this community over decades. And here's another important number. Each year, these services spare many children a lifetime of disability. They keep people out of the hospital. They spare families the need for painful and unnecessary tests. And they help to make costly treatments affordable for people who have no health insurance. Collectively, these treatments save the community more than $100 million a year in medical expenses. Now, these numbers are important to understand why we need a new building. The demand for our services continues to grow, and there's no apparent end to that need in sight. But I also think it's important today, when you look around you and you feel the spirit that brings us all together, to recognize that not everything that counts can be counted. Let me take you back in time in a different way to understand that. It's 1980, and you're a newborn baby with maple syrup urine disease. Before you reach the age of 2 weeks, you are very likely to be lying in an expensive ICU bed in a Philadelphia hospital, connected for your life to a breathing machine, deep in a coma. You are likely to stay in that place for 3 months until the doctors get a handle on how to take care of you. You can expect to leave wasting away and return many times in crisis before you make it to the age of 5 years. If you survive to the age of 5 years. You have only about a 60% chance of living that long. If you do live to your 5th birthday, you are very likely to suffer from significant mental and physical limitations for the rest of your life. It is almost a certainty that you will depend on the care of your aging parents and others to help you get through life. And it will be very difficult for you to have children of your own. There are parents here today, many of them, who know this story well. If you see them, shake their hand and ask them how they're doing. And ask them what the clinic means to them. They can explain it to you much better than I can. If you're that same child and you're born today down the street in Leola, your parents probably saw the diagnosis coming and had a chance to talk to one of our genetic counselors before you were born. It is almost certain that your midwife collected a blood sample the moment that umbilical cord blood was tested. The moment she cut the cord, she collected that and got it to the clinic. And you probably met your doctors and nurses on your second day of life before you got sick. Those same doctors and nurses would watch you grow up. They would be there for you to give you your baby shots, to make sure you stayed on your growth curve, to make sure you were developing normally. And importantly, they would be there to take care of you whenever you got sick. And they would be there whenever and wherever you needed them to be. You would have less than a 10% chance of being hospitalized each year. And half of you would never be hospitalized throughout your entire childhood. If you went to the hospital, it would be for an average of 4 days rather than 4 months. And the adjusted cost would be about 5% of what it would have cost you in 1980. You would drink the most scientifically advanced, safest, most effective MSUD formula ever produced. And if your parents chose so, you could have a curative liver transplant by the most experienced surgeons in the world. Importantly, you're likely to grow up healthy and very likely to raise a family of your own and face all the joys and sorrows that life has to offer. If you're born 10 or even 5 years from now with maple syrup urine disease, you might even be born at a time when there's a single IV infusion that we can give you within the first week of life that replaces your broken gene and spares you all the miseries of that for a lifetime. This is what we mean to keep the promise. We keep the promise by looking into our past to see the future. And it's a future that our grandchildren are going to inherit, and our great-grandchildren. And everyone here who contributes to this mission knows that in their hearts. That's what it means to build hope. I want to tell you one more story that reminded me of this recently. It was in December of last year when I paid my respects to a young boy who had been under the care of our Cherish Lives service, our palliative care service for infants with lethal genetic disorders. This is a service that has been run by a nurse at the clinic, Katura Byler, who's done an extraordinary job. But it's something that is close to the hearts of everyone at the clinic This boy had died at the age of just 17 months from a condition called Nemelin rod myopathy, a lethal muscle disease for which we have no treatment. He was the second child that these young parents lost to this disease. I arrived at their home early in the morning before the parents had actually awoken, and I was allowed into the house by a family member who brought me to the side of this boy's casket, his open casket. And in those early morning hours, I had an opportunity to stand there alone for what seemed like a long time. And during that time, I was overcome with a lot of different thoughts and emotions. After serving the community for 22 years, I stood by that boy's body, and I felt not only sad, but I felt defeated. I felt humbled that there wasn't more that I could do for him in this world. And I don't know how much time passed, but after a while I heard his parents stirring in the house. And then they came to stand beside me at the casket. And as sad as that moment was, there was something very sacred about it for all of us. It was a beautiful moment in a way. And I felt myself overwhelmed by gratitude to have known a child like that, to have been entrusted with that child's care, and to be able to serve a family and a community who understood the deeper meaning of his life. It was a reminder that in the end we all care about the same things. We couldn't change the course of that boy's disease, but we could join together as a community, as friends, with the whole CSC family to give him the happiest and most comfortable life that he could have for his short time with us. As I was leaving the house that morning, there was a few parting words that brought the full meaning of our work at the Clinic for Special Children upon me. The boy's father told me how thankful he was that God gave him this child to care for, despite all the pain that it had caused. It taught his family the greater meaning of sacrifice and the deeper truth of love. Yet just before I walked out, I asked his mother, what more can the clinic do to support your family in this time of grieving? And her answer came very quickly. Find a cure. Find a cure. Like Easter Saturday, the clinic is poised right between anguish and hope. We are there for families in their darkest hours, and we are there to give them hope for a brighter future. You are all part of that mission. And I thank you for that. Thank you for that. I'm going to conclude with a lighter story, which I think you'll all understand. I was reminded when I looked around here at all these items that have been donated of a passage that was in a quilting news paper published in 1877 in the Zanesville Daily Counter from Zanesville, Ohio. About 150 years ago, a man wrote into the paper complaining about quilters. And he said, these are not my words, these are the words of this man. He wrote, "Another silly Ohio woman has just completed a quilt containing, yes, 1,000 pieces. A woman who spends her time over such worthless nonsense, when there is so much useful and beautiful work to be done in the world, ought to be ashamed of herself." Now, apparently, in this man's eyes, the quilt that had kept her family warm on cold Ohio nights for that winter and so many generations to come was neither beautiful nor useful. Apparently, that man could not see the beauty of her work, stretching over and admired by generations to come. And by reading this man's words, we learn almost nothing about him. We don't know how old he was. We can't tell what his occupation was. We don't even know if or where he went to church. He might or might not have a family of his own. But there is one thing we know about this man for certain. He has never attended a clinic quilt auction. I see a beauty and a usefulness in everything around you here today. And I hope you see that too. I know that you do. Every item here has a story. And I just want to talk for one moment about this item, which has a very special story to me. You've seen a lot of these wonderful baskets going up on the block. But this one's a little different, this one here next to you. This basket, which is going to go up for auction shortly after I conclude here, is called Wonderfully Made, a reminder from Scripture that we are fearfully and wonderfully made. The items in this basket are all produced and donated by children and adults who face special needs, who have significant physical or mental challenges that they overcome every day. And they have given of themselves to give you the opportunity to give to others. In here, you'll find coffee by Tristan, who lost his eyesight, but manages apparently to make the best coffee in Lancaster County, I'm told, to support his wife and 5 children. There are cards here by a man named David, who has suffered and overcome significant physical challenges since birth. And he makes the cards by holding a brush in his mouth to paint. There are aprons and scrubbies here by the 4 adult Weaver children who have spinal muscular atrophy. They're all confined to a wheelchair, but manage to continue to give of themselves to support the clinic as they watch younger children with their condition all but cured by a new gene therapy. So I'm going to challenge you to think about what this basket means and all the items here, and take the opportunity to keep the promise for those who had the grace to donate and make this basket possible. Thank you for coming. Thank you for what you all do.